My name is Tammy Stafford, and I am a nurse. I have a bachelor's degree from IU, and I am the executive director of St. Martin's Healthcare. The clinic actually started about 2 years ago. We had a steering committee meeting that was called by Father Tom Lombardi. At that time, he's the pastor of St. Joseph Catholic Church, and he sent letters out to all people in the DeKalb County community that were healthcare professionals, from doctors to nurses, pharmacists, dentists. And we had about 30 people come to the steering committee meeting, and we determined that we had enough people that were willing to help get a free clinic started. We survive solely on volunteers and donations. We utilize a lot of samples. Probably the biggest line item in our budget is medications that we buy for our patients who are unable to get them through the patient assistance program. Most of them are able to get medications that way, but some things are generic, and medication assistance programs through the drug companies are only for name brand drugs.
When clients come to St. Martin's Healthcare Clinic, we first of all ask them if they are a resident of DeKalb County, and they provide us with a picture ID, ask them if they have any kind of insurance at all. And if they don't, then they qualify to be one of our clients for the clinic. And when they return the clipboard to me with their information, I enter it into the computer and make them a file. Then they get called by one of the nurses, and they come in and see the doctor who has volunteered to be at the clinic for the evening. At that time, they will have an exam by the doctor, and the doctor will determine if they need any medication or a referral to the hospital for any tests to be run. And if we can fill their pharmacy needs right from the clinic, they get their medicines that evening. They can also speak with someone at the clinic about a prescription assistance program that's also available if we don't have the medications.
My job here at St. Martin's Healthcare Clinic is to just work in the pharmacy or the drug room here. What I do is I prepare prescription medications, give the patients any advice that they might need for them, and just basically get them enough supply until the drug companies can supply their medications for them for free.
Services that we provide at the clinic are basic lab testing, such as high cholesterol. We can do cholesterol screenings, liver profiles, blood sugar screenings, hemoglobins, and hemoglobin A1C, which tells how good a control a diabetic patient has. Different kinds of cultures, pregnancy tests, basic lab tests we do here. Anything else we have to send to DeKalb Hospital, but they are very gracious and help our patients also by determining financial need for services.
If you didn't have nurses, if you didn't have nurse practitioners, if you didn't have pharmacists, heck, if you didn't have the clerical staff who checks in the patients, this would come to a standstill.
When I went to medical school, that was almost the rule. I think that type of concern about our community, about our nation, drove a lot of healthcare workers, whether they were doctors, nurses, whatever it might be, into becoming involved in the medical field. My approach has always been, don't look at anybody's insurance before you see them. Just see anyone and everyone who walks through the door. That's always been my philosophy, and also my medical colleagues. It was generally their philosophy also.
People should donate their time, not only because, to help people and, to provide assistance to people, but also here at St. Martin's, since the beginning, we've developed, many friendships working together, and it's, it's almost like a family here.
I've been coming here for about 8 months now, and I like it. I like their work. They're trying to help, there's certain things that they can't prescribe because of the clinic, they like Schedule II, Schedule I drugs and things that some people need that they can't get it, but they give you something to help you, the best they can.
I guess I would want them to know that we're grateful for the support that the community has shown to the clinic. Our patients are grateful that we're here, but it has to be ongoing. For us to be able to be here 30 years from now, everybody has to keep doing what they're doing, because otherwise we won't be here. So hopefully everyone will continue. We won't no longer be the new kid on the block, and people will forget about us then.